forcing me to say this. I think she really took care of me, the whole team. It made it actually quite enjoyable. Only the part, obviously, with the needles, it was a bit sore. They were injecting into my head. But other than that, I can't wait for the next session.
Nishant, are you ready for your treatment today?
Yes, I'm ready today.
So you're not afraid of the pain?
I'm a bit afraid, but I know I'm in good hands.
So let's see if you say the same thing afterwards, right?
Exactly, let's see.
Okay, we're going to spin this down and then we're going to inject it into your scalp. Okay.
So how does this even work?
Oh, we're going to spin this blood down for about 20 minutes and then we're going to separate it further to get a concentrate. That's called your PRP or platelet-rich plasma, right? And platelets release a whole lot of growth factors.
Yes.
That's how it's going to stimulate hair growth, prevent hair fall. You have genetic traits of male pattern hair loss. So you're going to inject it around the hairline to prevent further loss. So it prevents a receding hairline and wherever we see that the hair is a little bit thin. So it's more maintenance for you. Once you start seeing a shiny scalp where there's no follicles, then you'd have to go in for a hair transplant. So male pattern baldness is a hormonal component, right? So we'd have to add in other hormone blockers, sometimes stimulatory shampoos to prevent it because we can't change you genetically. So basically you have DHT receptors concentration on the top of your head. So by doing this, we're kind of preventing more loss, and then we'll use minoxidil spray as well to help retain some hair. But technically you have to maintain it for life, and you can use hormone blocker tablets to aid that process because it blocks the DHT receptor, but it also has side effects, so it's something to think about.
So with PRP, you would say that it's more of a preventative measure?
Preventative, and it can thicken your hair. So it's a bit of both. PRP is only suitable for people without diabetes, who don't have any infectious diseases. It's the quality of your blood that gives you the results.
So for people with diabetes, what do you suggest?
So there's other options, right? We have peptides, hair filler, stem cell therapy. So we're going to extract this part. Take it from there.
So you're going to go to the gym and give a chick dance partner. Will your partner not be jealous?
Yeah, we're friends now. So interesting story. Do you want to know the story? Okay, I'll share why I'm mixing. So I was a real big nerd in school. I had the longest skirt in high school. I was more worried about studying and doing well in school. And so my matric dance date was actually my parents' friend's son.
I would never believe you're such a nerd.
I was.
And I wouldn't believe that you couldn't get a chick dance partner.
No, I couldn't really. I was quiet and shy. So, who did you go?
I didn't end up going for a chick dance.
You missed out. Oh man.
So doctor, how long do you think the procedure will be?
So the injections are pretty quick, right? The time we waste is basically on spinning the PRP down. That takes the longest time. And the rest is quite smooth sailing. We have to work fast now because this will clot. You good, Lashanda?
I'm good, doctor. So doctor, with all these new strains and viruses coming out, what would you suggest the best preventative measures?
Always wash your hands. Don't touch your eyes, your mouth without washing your hands because that's how viruses spread easier. Also, if you are ill, be responsible. Cover your mouth when you cough. Always stay hydrated. And I believe that you should take vitamin C, zinc, and vitamin D3 to boost your immune system, especially if you keep getting recurrent viral infections. And then there could be other causes too, like if you have chronic allergic rhinitis and allergies and things like that, you're more prone to getting an infection. And even if you're sleeping with the air conditioner on, it dries out your mucous membranes, so you're more prone to picking up a viral infection.
What's your stance with people taking antibiotics all the time?
Well, you shouldn't really do that because one is if it's a virus, antibiotics not really going to do anything, and two is you're creating antibiotic resistance. So if you keep using antibiotics unnecessarily, you end up getting superbugs, which are bugs that are resistant to the treatment of the antibiotics we currently have. So we're creating problems in the long run. So you need to wait until you actually need the antibiotic.
And is it true that if you're taking an antibiotic, do you have to take it in conjunction with other medication? Because lots of people say you don't need to take the other medication if you're taking an antibiotic.
No, you do, because the antibiotic just kills the bug, right? Let's say you have an upper respiratory tract infection. So then like a bacterial sinusitis. Yes, you need the antibiotic to kill the bug, but then you also need supporting medication like antihistamines and stuff to clear the nasal airway. You're gonna need anti-inflammatory for the inflammation and for the pain and fever. And I like using mucolytic agent. I can't mention the name, but use that to like thin the mucus production so it comes out of your nose. So you have to use a conjunction of treatment. So every drug that is prescribed will have some sort of effect on the illness to help you recover faster. How was it?
It was painful, but I think I was in good hands, so it made it not as painful as it seemed.